Good evening, everyone, and welcome to High Blood Pressure and Pharmacology. Thank you for joining us at this hypertension workshop tonight. Wanted to remind you that we have a couple of upcoming sessions. We have a little bit of a gap, so the next session will be on August 23rd with Dr. Mirza, and then again on August 30th with Dr. Mirza. The topics will be, the next one on the 23rd is adherence to high blood pressure therapy. And then the final one on August 30th will be on urgencies and emergencies with hypertension. Tonight, as I said, we'll be talking about high blood pressure and pharmacology, and that will be presented by Kristen Marty. She's here with us. She was here with us last year and is joining us again this year to talk a little bit about pharmacology and the types of medication used to control high blood pressure. Wanted to remind you that these are done with block grant support through the Department of Public Health in coordination with the town of Windsor. These are also being archived and are available for review if you'd like to see them again or have others who might be interested. And so you can see the town of Windsor website to access that information. I also reminded you today that I am working on pulling together a bag of educational materials and some other high blood pressure items. So stay tuned for a pickup date as those will be distributed. With that, I'm going to turn it over to Kristen. Just one last thing, I will be doing a demonstration as we have at each workshop of the use of the self-monitoring blood pressure device. If you've had any trouble accessing one of those, please let me know and I can work with you to get you one for home. All right, Kristen, with that, it's all yours.
All right, thank you, Jenny. Hi, everybody. As Jenny mentioned, my name is Kristen Marty, and I am currently a pharmacist at Hartford Hospital. So just a little bit about myself. I went to UConn, graduated pharmacy school in May of 2020. So I've been a real pharmacist for about a year right now. Before I became a pharmacist, I used to work at CVS, which is right next door, for 5 years. I did a residency, a year-long residency at Hartford Hospital. And then I just finished my residency in June, and I enjoyed, working at Hartford Hospital so much that I stayed on working as a full-time pharmacist now at Hartford Hospital. I did this presentation last year, and I was so excited when I was asked again to do it again this year. So I'm very glad that you were all able to call in tonight and listen to my presentation about high blood pressure and pharmacology. If you have any questions throughout, feel free to write down your questions, take notes. We're going to have a little Q&A session at the end of this presentation. So I'll be happy to answer any of your questions at the end of the presentation. All right. So these are the objectives that I hope to cover throughout this presentation, among others, but really I'm really looking for us to kind of go over and discuss common high blood pressure medications so that you'll be able to recognize them if your doctor ever mentions them. So recognizing these medications and also being able to briefly explain how they work. We'll be defining high blood pressure treatment goals and discussing how to achieve these goals, and I'll be giving you some helpful tips in addition to those that you've already learned throughout these other sessions that you've attended. And we'll be identifying coexisting medical conditions that are associated with high blood pressure. So we're really going to start talking about the pharmacology first, which is essentially the medication. So we'll be going over high blood pressure medications, which your doctor may refer to as antihypertensives. Hypertension is another word for high blood pressure. That's the medical term for high blood pressure. So antihypertensives are essentially medications that treat high blood pressure. There's many different classes of high blood pressure medications, and there's a lot of different ones out on the market. So we're going to go over them. There's essentially 3 areas that these antihypertensives work. The antihypertensives work in your heart, in your blood vessels, and in your kidneys. We're first going to review the medications that work in your heart to lower your blood pressure. The first class of medications that we're going to discuss are calcium channel blockers. So these medications work by preventing calcium from entering your heart muscle cells. I don't know if you know this, but your heart really relies on calcium to form these heart contractions. So the way that your heart beats, it requires calcium to beat. By preventing some calcium from entering your heart muscle cells, you're reducing your heart rate and the force that your heart is contracting at. Both of those mechanisms ultimately help in reducing your blood pressure. There's two medications that are in this class that work this way that you may have heard of. So we have diltiazem and verapamil. These medications do have some side effects. Specifically, they may cause headache. Specific with calcium channel blockers, they may cause some leg swelling and some constipation. So if you experience any of those medications while on this, or any of these side effects while on this medication, it's important to inform your healthcare provider, whether it's your doctor, or also inform your pharmacist, because they may have some recommendations as well. The next class of medications that also, works on the heart, but in a little bit of a different way, are called beta blockers. These medications work by reducing the amount of work that is put on your heart, so reduces the workload by lowering your heart rate and by lowering the heart's output of blood. So in that way, it reduces your blood pressure. There's some example medications of these beta blockers listed on the screen here. For example, atenolol, bisoprolol, carvedilol, labetalol, and metoprolol. There are a couple others that are not listed on this screen, but can be used for blood pressure. These are the most commonly used, and as you can see, they all end in LOL. So that's how you are able to identify beta blocker from other medications, is they end in that LOL. As I mentioned, these medications reduce the workload on your heart. So a side effect of these medications are low heart rate. If you do have a lower heart rate while on this medication, you can know that, that's what the medication is supposed to be doing. However, if it gets too low, that's something that, we try to avoid. So that's something that may, become a conversation with your healthcare provider if your heart rate becomes too low. Fatigue and dizziness are other common side effects. And then one side effect that I did want to point out is that these medications may mask signs of low blood sugar. So that's especially important, especially if you have a history of diabetes, because if you do have low blood sugar, signs of low blood sugar may be like hand shaking. These medications can mask those signs. So it's something important to know if you do have that history of diabetes. So those are really the two classes of medications that work on the heart. The next class of medications we're going to talk about are those that work on the blood vessels. So I think for this group of medications, it's important to kind of think of your blood vessel as a hose, okay? And thinking if you have a really small hose with a really narrow diameter, so it's kind of like a thin hose, if you push a lot of water through it, the pressure is going to be high. However, if you have a big hose, like, a firefighter hose, and you have the same amount of water flowing through it, the pressure is going to be less. So that's kind of similar to what your blood vessels, how their blood vessels are acting in this scenario. So the first class of medications we're going to talk about are calcium channel blockers. And as you know, I just talked about calcium channel blockers a couple minutes ago as those medications working on the heart. But there's really two classes of calcium channel blockers, one that works on the heart and then one that works on your blood vessels. So these medications, amlodipine, felodipine, or nifedipine, are the calcium channel blockers that work on your blood vessels. Similarly, they prevent calcium from entering the muscle cells in your blood vessels that cause contraction. So by blocking that, your blood vessels are relaxed and more open, allowing blood to flow through your blood vessels at a lower blood pressure. Similar to the other calcium channel blockers, these medications can cause headache, leg swelling, and constipation. But additionally, it can cause some flushing. And that's because, as you're opening up the blood vessels, if you think on your face, for example, you have blood vessels flowing through your face. If you open up those blood vessels, your face becomes redder and you may feel more flushed. So if you're taking one of these medications, it may be common to see some sort of flushing side effects from it. The next class are the angiotensin converting enzyme inhibitors, or more commonly known as the ACE inhibitors. That's a long name for a class of medications that essentially just inhibits this enzyme, we call it, in your body that basically metabolizes one product to another product. But it's just important to know that this medication does work on your blood vessels. It relaxes and opens the blood vessels in your body to lower the blood pressure. These medications also do work in your kidneys to help lower blood pressure as well. These medications all end in the word, or in the couple letters, the PRIL, so pril. So benazepril, enalapril, lisinopril, quinapril, or ramipril. Some side effects of these medications are listed here. The first one being cough. Now, cough is a side effect that you may see at any time that you're on one of these medications, whether you've been on it for a couple weeks or a couple years. And this is more so of a pesky cough, a dry cough. It really isn't a cough where you're coughing up stuff. It's more of just a dry, pesky cough. If you are experiencing this side effect from one of these medications, there's other options. Your doctor can switch you off of the ACE inhibitor onto another medication. So definitely important to let your provider know if you're experiencing a cough on this medication. High potassium is another side effect. Your doctor may be watching or ordering lab tests for you to check your blood levels of your potassium. These medications may cause some renal impairment. However, in patients with kidney issues, they actually may put them on one of these medications to help with that. So it's just important to know that it can go both ways. And the last side effect that I have listed here is facial swelling. Now, facial swelling is a very rare side effect of these medications that similarly can happen whether you've been on this medication for 2 weeks or for 2 years. This is a very serious side effect, though, if this does happen on these medications. So just important to know that if you're experiencing any, facial swelling, tongue swelling, difficulty breathing, to let your healthcare provider know. It is a very rare side effect, though. Just keep that in mind. The next class of medications are the ARBs, or the angiotensin II receptor blockers, that essentially work in the same way as the class before. But essentially, these medications prevent angiotensin from causing blood vessels to constrict. Therefore, the blood vessels are more open, allowing blood to flow through more easily, essentially lowering blood pressure. Examples of these medications are listed here. They're the sartans. So losartan, valsartan, irbesartan, and olmesartan. These medications, this class of medications, ultimately has the same side effects as the ACE inhibitors. They're very similar medications in a lot of different ways. So again, looking out for a cough that can happen within weeks to years, high potassium, renal impairment, and then facial swelling as well. I will say, though, that the facial swelling and cough are much less common than that with the ACE inhibitors. However, it can still happen if you're on one of these medications. The next class of medications are the alpha blockers. These medications work by reducing the muscle tone in the artery walls to relax and open the blood vessels. letting more blood flow through with less pressure, ultimately lowering your blood pressure. Some examples of these medications are doxazosin, prazosin, and terazosin. And some side effects are headache, dizziness, and low blood pressure, which essentially is what these medications are trying to do, is lower your blood pressure. However, with these medications, they're very good at what they do, so they may lower your blood pressure too much. And then some other miscellaneous blood pressure medications we have here are clonidine and hydralazine. Essentially, they work the same way as the other ones that we have mentioned. Relaxing and opening blood vessels to lower blood pressure may cause headache and low blood pressure. So those are the medications that work on your blood vessels. I'm now going to talk about the last group of medications of antihypertensives that work on your kidneys. The main class of medications here are the diuretics. These diuretics essentially work as a way to help your body get rid of excess water in your system. This medication is commonly called, these medications are commonly called the water pill, because essentially it turns on your kidneys to get rid of as much water and electrolytes as possible. So essentially you can kind of think of it as turning the faucet on, helping you excrete all this excess water and salt in your body. As a side effect, which I'll talk about in a little bit, it does increase the amount that you do, go to the bathroom. So just something to keep in mind. Some example medications here are our thiazides, being hydrochlorothiazide and chlorthalidone. We have some potassium-sparing diuretics like spironolactone and triamterene. And then we have our loop diuretics, so furosemide, torsemide, and bumetanide. So these water pills do come with some counseling points. First, your healthcare provider is going to want to probably have you come for frequent blood tests, because these medications can cause some electrolyte disturbances in your blood. So they may cause low sodium, potassium, magnesium, and calcium. So your healthcare provider will likely order frequent lab tests on you just to make sure that these levels are all within the ranges that they should be. As I mentioned, these medications do make you urinate a lot, so you probably will have to go to the bathroom more frequently than you would normally. So an important point on, when you're on one of these medications is you don't want to have to be waking up in the middle of the night to go to the bathroom. So it's important that you take these medications as early in the day as possible to avoid having to wake up to go to the bathroom at night. A common tip is just to not use these later than 4 p.m. Obviously, if your healthcare provider requests that you take it closer to nighttime, follow whatever directions that they use, but a general rule of thumb is 4 p.m. For some side effects, you may feel lightheaded or dizzy when you're taking this medication, especially when standing. And that's because you're getting rid of all this extra fluid. You might be a little dehydrated. So it's important that when you're going from sitting to standing or laying down to standing, just to take it slow. And if you're feeling dizzy, just to sit back down. So those are the medications that we use to treat high blood pressure. I know it's a lot there, but obviously if you ever have any questions, you have your healthcare provider, and you also have your pharmacist who's very readily available to answer your questions about those medications. So before we get into blood pressure goal and how to achieve it, I'm just going to take a little break for a sip of water. But again, if you have any questions on medications, just jot them down. We can talk about it at the end of the session.
I didn't quite hear what you said. If we have any questions, to just write them, you said it like in the chat, and you'll discuss them at the end. Is that what you said?
Yeah, so you can just jot it down on a piece of paper. We're going to have a little Q&A session right after the end of this. So, if you're taking notes, just jot it down on a piece of paper and we can discuss afterwards.
Oh, okay, sure.
All right, so we're now going to talk about blood pressure goals and give you some little tips about how to achieve these goals. So if you've ever taken your blood pressure or have gone to your doctor's office and they take your blood pressure, they give you a number. So we're kind of going to go over what this number actually means. So your doctor, or if you're taking your own blood pressure, you'll notice that there's two numbers. For example, a reading of 120/80, okay? The first number is called the systolic number. That's the top number. And that essentially is the pressure that your heart is putting on your blood vessels when your heart contracts. The diastolic is the bottom number, and that's the pressure that's in your blood vessels when your heart relaxes. So both of those numbers are important in terms of diagnosing hypertension. The chart on the left of the screen here that says know your blood pressure readings lists the different systolic and diastolic blood pressure readings and how it correlates to our diagnosis of hypertension. So essentially, a normal blood pressure is defined as that which is less than 120/80. Okay? An elevated blood pressure is 120 to 129 with the diastolic, so the bottom number, still less than 80. When you are diagnosed with high blood pressure, which is stage 1 hypertension, you are likely to have a reading of 130 to 139 over 80 to 89. And then stage 2 hypertension is greater than 140 over greater than 90. So if you fall within that stage 1 or stage 2 hypertension, that's likely when your provider will consider and discuss with you about starting some sort of medication for your hypertension. But generally, if your blood pressure is normal or elevated, there's no need for antihypertensive medications. If your blood pressure is elevated but not stage 1 hypertension, there's definitely room for some lifestyle modifications, whether it be diet, exercise, smoking cessation, which we'll talk about later, but not room for medication therapy just yet. And then if you do have a reading ever of greater than 180 or over greater than 120, that really is a hypertensive crisis. This is a medical emergency, so it's very important that if you ever see numbers above 180 and or above 120 to seek medical attention, because it can ultimately cause damage to your other organs as well. But essentially, this is how blood pressure is diagnosed based off of your readings. Generally, the target for blood pressure treatment is less than 130/80. We'll talk about that a little more later. I have here 4 tips listed on how to achieve your blood pressure goals, and we'll kind of talk about each separately. But essentially, the 4 tips are engaging your healthcare team, taking your medication faithfully, monitoring your blood pressure, and making healthy decisions. So first, engaging your healthcare team. As with all medical decisions, you really want to make sure that all healthcare professionals are engaged in your care, including, your healthcare provider, whether it's a doctor, physician assistant, APRN, the nurses that you see when you go to the doctor's office, the pharmacists that you see when you go to pick up your medications. You want to make sure that, if you have any questions, that you're, asking those questions and really keeping them in the loop with how you're doing. If you're experiencing any side effects from the medications, if there's any reason that you're not taking the medications, because it's important that everybody's on the same page in terms of, helping guide your care. When we're talking about making a list of these questions that you want to ask your provider, some good questions to ask your provider is, what is my blood pressure goal? If you're monitoring your blood pressure on a daily basis, you want to make sure that you know what your goal is to see if you're achieving that goal. So making sure that you ask them what their goal is and asking them if they have any tips on what the best ways to reach your goal is. It's also very important to mention to them what you're already doing to work toward, achieving your blood pressure goal. Like how much you're exercising, if you're exercising, if you've made any changes to your diet, and if you have, what changes have you made? And then if you've been taking your medications, what medications you've been taking, if you've been taking them as prescribed, if you've ever missed a dose. It's just important to keep all of these, keep your provider in the loop with everything that's going on in terms of, your lifestyle modifications and how you're taking your medications. In terms of, making goals, you want to be honest and realistic with yourself. Is this a goal that I'm able to achieve? Am I pushing myself too much? In terms of, making these lifestyle changes, if there's a couple goals that you want to achieve, really just pick one goal to start working toward. And once you have made good progress on the goal and achieved that goal, pick another goal. But it's really important that you just focus on one at a time. Now, in terms of taking your medication faithfully, as pharmacists, we always talk about, the importance of medication adherence. So, whether or not, patients take their medications as prescribed on a daily basis, as often as, the provider wants them to take it. But, obviously, we have to be realistic, and life happens, things come up, and sometimes you're not able to take it as prescribed. So if you find yourself that you're not taking your medications as prescribed, ask yourself why. Is there, a cost issue with your medication? If that's the case, you can talk to your pharmacist to see if there's, cheaper alternatives. Is the issue that you just forget to take your medications? Because then there's other, options to help, remind yourself if that's the issue. So, it's really just important that you sort of self-reflect to see, if you're not taking your medication faithfully, ask yourself why. In terms of, if the answer to that question is that you forget to take your medications, making a schedule is really, really helpful. Setting up some sort of system to remind you to take your medications regularly. A common and very reliable reminder system is using a pill box for every pill or every day to help with your medications. We do have a pill box, here that Jenny gave us. It's just, in a little circle, and it says, you probably can't see this, but it goes Monday, Tuesday, Wednesday, all the way through Sunday. It goes around. And then in each day, for example, this one's Monday, it says morning, noon, evening, and bedtime. So just having some sort of organization system, would definitely, benefit you if you, forget to take your medications for any reason. And it's important, if you do have one of these pill boxes, to keep it in a place that you go frequently, whether it's on your nightstand or on the kitchen table, somewhere that you would definitely look every day, just to help, remind you that you're, have some medications to take. And I also really do like this pill box because it does separate, the doses between morning, noon, evening, and bedtime. So if you're able to find something similar to this, especially if you take multiple medications during the day, I think that would be very helpful in terms of helping you remember the medications. Another, piece of advice is that if your insurance provides mail order delivery, make sure that you, work with the pharmacy, the mail order pharmacy, to set it up and request 90-day supplies of your medications. That way, you can, you don't have to request the medication refills as frequently, but also you have more of a supply on hand. If that's not available to you, it's helpful to schedule all your refills at the pharmacy to pick up at the same time each month, so that when you go to the pharmacy, you can go for one trip and pick up multiple medications rather than having to go pick up one medication here and there. Something that your pharmacist can definitely work with you towards coordinating, because that can be tricky from my experience in retail pharmacy. It's also important to talk to your doctor about any side effects you're experiencing with medication. Are you not taking your medication because you have a cough or it's just making you feel funny? If that's the case, then it's definitely worth talking to your doctor about this side effect, because as we talked about earlier in the presentation, there's a lot of different medications that we can use to treat high blood pressure. So if there's one that really isn't making you feel great, we have a lot of other options. If a medication really isn't making you feel well, it's important that you don't stop taking the medication on your own, unless it's, sort of life-threatening, like you're having difficulty breathing and whatnot. But if the medication's, giving you a cough or making you nauseous, I guess it really is, risk versus benefit in that case, but definitely, important to talk to your doctor before you stop taking your medications. We didn't talk about this yet, but high blood pressure really is a silent disease, because you could be walking around with high blood pressure and really not even know it. High blood pressure doesn't have a lot of symptoms, if any symptoms. It's really just diagnosed based on, what your blood pressure readings are. So you may not feel like you may not feel a difference when you take your medication or when you don't take your medication, but just know that if you don't take your medication, your blood pressure is high. You may not feel sick, but it could be dangerous to be walking around with that blood pressure so high. Now, in terms of monitoring your blood pressure, I think you probably talked about this at another session, and then I know Jenny's going to talk about it later in the session today. But it's really important that if you don't already have a home blood pressure monitor, if you're able to get one, I think that would be a really great idea for you. But the doctor's office always does have blood pressure monitors there. Your local pharmacy has a blood pressure monitor, and that's convenient too, because the pharmacist is right near that blood pressure monitor. So if you ever have any questions on what the readings are, you can just ask your pharmacist, and they're able to assist you. And then getting a home blood pressure monitor would definitely be a good idea, especially if you wanted to kind of keep a closer eye on your blood pressure. And if you do that, it's important to track the results in a log or a diary so that you're able to monitor your progress. And your doctor may actually ask you to bring in that log when you come in to your next appointment, just to see what your blood pressure trends have been, rather than just taking it once on a single day. This is just an example of a blood pressure log. This is on healthyliving.com, so you can go online and download that. But essentially, you want to track the date and time of the blood pressure, and also, if you can, log your pulse, which essentially is your heart rate. So if you keep track of this and then bring it to your doctor's office, this gives them a good idea of what your baseline blood pressure is, rather than, if you are running late to your doctor's appointment, hike up 5 flights of stairs, and then you sit down in the chair, and then they take your blood pressure. My blood pressure would probably be through the roof. So then they'd be like, oh, you have hypertension. But like, oh, look at my blood pressure readings on a daily basis. So that's why I really advocate for, kind of blood pressure diaries like this, because this is definitely more of an accurate assessment of how your blood pressure is controlled, rather than when they take it in the office. And then making healthy choices. Obviously, I'm sure you've talked about exercise in a previous session, but really exercising as much as you can. You know, there's a lot of different guidelines that say how much you should be exercising. But what I always like to say to people is however much you can. You know, I know you're all busy, you have a lot going on. If you can't designate, you know, like 1 hour a day, like that's totally reasonable. I can't designate an hour a day. So whatever you can in terms of, you know, just getting out, even if it's for like a 10 or 20-minute walk a day, you know, that makes a big difference in the long term. Diet, so, you know, healthy eating, and then smoking cessation too. Smoking is one of the most common causes of high blood pressure. And it's, you know, a risk factor that, you know, we call modifiable. So, you know, if you do smoke, that's something that you can change. So that, you know, and if you do smoking, that's why we highly advise that you know, quit smoking. And then your healthcare provider can obviously help in terms of quitting because it can be difficult. In terms of diet, choosing fresh fruit, vegetables, and whole grains are your best options. We want to make sure that we avoid high sodium, foods with that are high in cholesterol, saturated fat, and trans fat. And then learning how to read food labels is very important. We do have a food label here. You know, this specific food label shows that there's 230 calories. But it's important to know that that's per serving. For example, this specific food label shows that this food has 8 servings per container. So that 230 calories isn't for the whole container. That's only per serving, which in this case is 2/3 of a cup. Important things, other things to look at on the food label are the trans fat, the cholesterol, and the sodium. For example, this food has 160 milligrams of sodium, which is 7% of the daily value. You know, if you do have high blood pressure, you really want to make sure that you're choosing foods lower in sodium. So, you know, if you're gonna, you know, it's just important to keep that in mind when choosing foods. I'm not saying that you have to track how much sodium you're eating per day. However, if you do have sort of, we call uncontrolled high blood pressure, that may be in your best benefit to kind of track how much sodium you're eating or you're taking in. Our last section here, we're going to be talking about common conditions that lead to hypertension, because hypertension is its own, you know, kind of disease state. However, there's a lot of other conditions that may actually cause hypertension or are at least related to hypertension. So, you know, some disease states may enhance the risk of developing hypertension due to changes in the body and blood vessels. These disease states include diabetes, chronic kidney disease, obstructive sleep apnea, and dyslipidemia, which is another term for high cholesterol. I mentioned a little bit earlier about a modifiable risk factor. So we have 2 classes of risk factors for hypertension. We have modifiable, which essentially are those risk factors that we can change, we can do something about. Those include smoking, obesity, physical inactivity, and an unhealthy diet. That is opposed to fixed risk factors, which essentially are risk factors that we really don't have much that we can do to avoid or at least mitigate those risk factors. These fixed risk factors include family history of hypertension, which is definitely a common cause of hypertension. Older age, low socioeconomic status. Males also have a higher risk of hypertension. And then psychosocial stress is another contributor to hypertension. Just important to keep in mind that there are different types of risk factors, some that we can't change and some that we can't change. So most common cause of hypertension, or presentation of hypertension, I should say, is primary hypertension, also known as essential hypertension. This is the case in over 90% of patients. Primary hypertension is typically due to a hereditary or a direct factor such as diet or low physical activity. That is compared to secondary hypertension, which is much less common, less than 10%, but some causes of secondary hypertension include renal disease, obstructive sleep apnea, drug or alcohol-induced hypertension, and then other less common causes are thyroid issues, so either hypothyroidism or hyperthyroidism, Cushing's syndrome, and acromegaly, which are both endocrine issues, so issues with your hormones. There are many complications of uncontrolled hypertension. You know, as I had mentioned earlier, hypertension really is a silent disease. You know, you could be walking around with high blood pressure and not even know it. However, it can be causing some damage to your organs. So it's really important that, you know, you treat high blood pressure even though you may not feel sick. Whereas, you know, if you get a cold, you'll feel sick and know that you're sick and you'll take something for that. However, high blood pressure, you don't really feel sick if you have the high blood pressure. But there are complications of this uncontrolled high blood pressure. It can lead to the development of other disease states, disability, and even poor quality of life. And it does so by stiffening arterial walls. Arteries are essentially blood vessels in your body, and it can also narrow these arteries, leading to poor oxygenation throughout your body. So hypertension can cause, when untreated, can cause damage to your heart due to the limited blood flow that goes to the heart and other areas of the body, which can potentially lead to several complications. Those being coronary artery disease, enlarged left heart, heart failure, and peripheral arterial disease. Hypertension can also cause kidney issues. So kidney problems that may develop secondary to hypertension include glomerulosclerosis, which essentially is scarring of your kidney tissue, and can also cause kidney failure or chronic kidney disease. Hypertension can also cause some issues in terms of the neuro system in your body. So for, you know, normal brain function really does rely on a sufficient blood supply. So if we're limiting the amount of blood that gets to our brain because of the hypertension, it can lead to various conditions, including stroke, transient ischemic attack, or a TIA, which essentially is a mini stroke. It can cause, lead to dementia and mild cognitive impairment. And then another organ that we don't really think about hypertension affecting is the eyes. So hypertension can affect these really small blood vessels that are in your eyes that essentially can cause visual impairments and visual damage. So it can cause retinopathy, which is damage to the retina, choroidopathy, which is a fluid buildup under the retina, and it can also cause optic neuropathy, so nerve damage. So, you know, you don't really think of the eye, you know, being connected to this, you know, whole hypertension picture, but just important to know that, you know, when left untreated, that is a possibility. There are, like I mentioned earlier, different associations put out different recommendations for blood pressure goals. There are certain goals for certain coexisting conditions. For example, if you have diabetes or if you have heart failure or chronic kidney disease, essentially, you know, there's blood pressure recommendations for each of those diseases. But generally, I will say probably 90% of the time, 90 to 95% of the time, the blood pressure goal is going to be less than 130 over 80. Again, you definitely want to check with your healthcare provider to see what your specific blood pressure goal is, because your provider may have a different goal for you in mind. So definitely I would recommend at your next visit just asking and following up with your provider about what that goal is. So with that, that's all that I have prepared for this presentation. Happy to answer any questions if there are any now. I think we're going to cut off the recording for right now.
I think it was a couple workshops ago that Paula Raines was here and described the use of the self-monitoring device. I wanted to remind you that, again, if you're having some difficulty obtaining one of these, please let me know because I do have them available. I think you'll remember that you're supposed to get up in the morning, use the bathroom, sit down, feet flat on the floor, back up against the wall, like this. And it's also supposed to be a quiet time. So this is oftentimes when I need to stop talking. But you'll take the cuff and you want to line that tubing up with the inner part of your elbow. This takes a little bit of coordination because as you tighten the cuff, sometimes that tubing will move. Let's make sure I get this on correctly. And so watching where that is as you then tighten up the cuff and secure it. You want that arm resting at about the level of your heart. The Omron device is a nice device. This one will actually save readings for a couple of people over time. Again, adjusting that. And then I'm going to be nice and quiet for a minute as I hit that start button. Once it's done, obviously you're going to remove it. You're going to record your blood pressure on your log as well as your heart rate. Good idea, again, as Kristen mentioned, to take that with you so that it can be compared to the readings you have in the office. The other thing that's important is it can compare the accuracy of your home device to make sure that it's getting fairly similar to reading that's happening in the office as well. All right? Any questions about the self-monitoring device? Okay. I also wanted to remind you, as I said earlier, that I'm working on pulling together a package of materials for you, the educational handouts that we've used for each and every presentation, the evaluation that I would like you to complete and return, as well as the pre-diabetes screening form. When that information gets returned, you earn in increments of $5 a First Town Downtown gift card. And it's important for me to distribute those. We have also ordered these pill organizers or medication organizers, and we'll distribute those to all of the attendants as well. So I will be getting that scheduled in the first couple of weeks of August in anticipation of the wrap up of the series on August 23rd and August 30th. Okay, and with that, if there are no further questions, we'll end this evening's workshop. Thank you all for being here tonight. Good night.
Good night.